confidence cannot substitute for intellect and cannot substitute for knowledge. Just because you say something with confidence does not mean that you're right. And America in general, we all, are, because it's such an incredible country and we have, I think the best people in the world, we have always been the ones that all the intellect, we've been the ones with the great education system, advancing critical thinking, and then bringing it all together to do incredible things like start companies, change the world, think about things very differently. But slowly, again, with that erosion, we've started to see a replacement of knowledge with confidence. In other words, we're saying you don't need to know what 2 times 2 is. You can just say 12 with confidence, and that's okay. And people do get a little further with that. But the danger with that is that when you send someone like that to Congress, they're going to speak loudly. They're going to slam their hands on the table. They're going to say the right things. They're going to have the little billboards, but what they're talking is crap. And so it is very important to find the people that we have in this millions and millions of people country, and we have them, that have the knowledge and have the confidence and have the moral compass. That is the trifecta that sends a person to Congress to really help the United States as a whole. And we've not been doing a good job of that as public citizens, picking those people.
All right, joining us today is Dr. Anahita Dua, a vascular surgeon, Harvard Medical School faculty member, and a nationally recognized voice on how medicine, policy, and power intersect. Dr. Dua practices at Massachusetts General Hospital, where her work focuses on vascular disease, limb salvage, and preventing amputations, areas of medicine where outcomes are often shaped as much by systems and access as by biology. Over the years, she's increasingly become an outspoken advocate about what happens when medical expertise is sidelined in public decision-making, whether that's around vaccines, public health guidance, or chronic diseases. That perspective recently led her to launch a political action committee aimed at helping medical professionals run for office, grounded in the belief that evidence-based medicine needs a stronger voice where laws are written. Today, we're not just going to talk about ideology, we're going to talk about medicine, what happens to patients when policy overrides evidence, how trust in healthcare is built or broken, and what responsibility clinicians have when public opinion and medical science diverge. Dr. Dua, thank you so much for being here with us today. I'm very excited to have you.
Thank you so much for having me. I'm thrilled to talk about these topics.
Yeah. Why don't you just kick it off with, when did you realize you wanted to become a doctor and why?
So many, many, many years ago when I was a child, but frankly, I came from a family of doctors. So it's not that I didn't see the lifestyle and didn't understand what they did. And, I would sit at the dinner table and mom had to run off and dad had to run off and I would see that. But it was always something that was such a noble cause, something that I could really, even as a child, understand why daddy and mommy were leaving. And as I grew up and started to learn about the impact that I could have through my life on others, medicine seemed like the only way forward. And as I, went into medical school and started to explore different specialties, vascular surgery really stood out to me because, picking a medical specialty is much like falling in love. Like you have this list of things you want in a partner, but then if you actually look at who you end up with, most of the time it has nothing to do with what your list was because it just ends up being something that brings out an emotion in you that you didn't know was there. And so again, picking that specialty, I realized that vascular surgery was the place where I could do the most good. And it was, of course, the most interesting and frankly, I think the most difficult. And that's why I came into it to make a difference.
All great things. I love that you were inspired by your parents to become a medical professional yourself. I think the work that you're really doing is important. Vascular health and limb salvagement is a huge, huge thing, I do want to ask you a question really quick. Who actually decides what good medicine is in the United States today before politics even enters a conversation?
So good medicine has one North Star, and that is that you take everything into account for the patient and you do the best thing for them. So interestingly, it's not a one size fits all. I'll give you an example. There can be a patient that is at the end of life that is in intense pain and having a lot of issues. And at this point, there could be a major surgery that you might be able to do for them to try to prolong their life. But the chances of that surgery being successful are like, 2%. And you don't want to kind of torture them in their last phase of life. So you might have a conversation with that person and say, hey, this is the right thing. We think, what do you think? And with the family and the patient, make the right decision for them. Almost the exact same scenario medically, but a different person can have a different conversation. We could be saying, no, for this family and for the psychology of this patient and what they want everything. So this is the right thing to do for that patient. And so it's really important to say, when you say good medicine, that you have to keep in mind that you're talking about the best outcome for the patient, not just in the classic, clean medical sense, but also in the social sense, in the psychological sense, in the functional sense. You could do an amazing surgery, but then they end up in rehab for the rest of their life and they may not want that. And so good medicine really comes from the patient, the doctor, and the family of the patient sitting together and deciding what's best as a group before anybody touches anything else.
Yeah, I've heard that a lot, that medicine is not black and white. One situation for one patient will not be the best for another one. And just kind of like personally, when my father fell very ill with, cancer before he had passed, we had these conversations. What does a good quality of life look like for him in these last precious moments that we have with him? And so that was a very tough conversation. So I know exactly what you're talking about. And that can be very stressful for a lot of families too, because you just want to snap your fingers and make everything better. And like you said, a surgery might help, but they might end up in rehab for the rest of their life. And what does that do to their quality of life? So
right.
That's some insightful information there. But so our healthcare system do you think our healthcare system right now is built to prioritize medical expertise or to negotiate between expertise and political pressure when they collide? I'll give you an example really quick. You are a faculty member at an Ivy League school, and with the current administration, there has been a lot of targeting as far as like research funding and things like that being gutted, which I'm sure has probably impacted, Harvard Medical School. What's your take on that?
Well, it's interesting. Yes, there are situations going on with this administration that are unique. But I would not let off the hook any of the other previous administrations. See, the thing about medicine, right, is that we come at it from the patient, and doctors are taught to be apolitical, which used to be accurate, is really unacceptable these days. You have to pick what the right thing to do for your patient is, and you have to move forward with that, even if that means a foray into politics. But my point is that any time that you have a government that has political determinations of what the right thing to do for the public is without actually taking into account the science, what is actually going on with that public, and ensuring that whatever you're doing for the public actually is serving them. The taxpayer money that's going into the NIH is actually coming back and funding grants that are actually translational, that are actually advancing medicine. And the government is not taking, complete accountability for that. You have a negative situation. So I'm not saying that historically anyone has done it with intention. And I think that's the key, that it's not like an administration is sitting around saying, hey, we're going to just screw up all the science and we're going to do, X, Y, Z to make it bad. But when you have political agendas and you want to push forward that political agenda, whatever side it may be, it is very common for things like the military, for things like medicine, for things like government assistance programs to become the soccer ball being kicked around and passed about in order to achieve a political goal that may not be in line with the actual benefit for the people. So I'll give you an example. Peripheral artery disease is a disease process that basically means blockages of blood flow in the legs. Okay? Peripheral artery disease is basically the same thing as a heart attack or a stroke, just it's in the legs. So if you have a heart attack, you have a blockage in your heart's not working. If you have a blockage in your neck and you get a stroke, your brain's not working. If you have a blockage in your legs, you can have an amputation. Now, because of the rise of diabetes, there has been an amputation epidemic in this country. But if you look, and I'm, again, not specific to an administration, just look back in the last 10 years, as these numbers are rising, you don't see that much attention being given to a major problem that ultimately does result in amputation and death in these patients. In fact, 50% of patients who get amputated above the age of 60 will be dead within a year. And the reason for that is because it's not had the appropriate political focus, because it's not been something in the mainstream that you or I talk about on a day-to-day basis. But look at the way that the policies work for things like breast cancer, right? Look at all the political push. And then if you go and you look at the money and how it's being divided, you'll see that it's going to particular causes. Now, there's nothing wrong with supporting aggressively breast cancer and ensuring that we get a cure for it. But my point is that all resources wouldn't go into one thing. So, speaking politically, basically in the 1970s, Nixon said, hey, I'm going to make cancer the moonshot project. I want to cure cancer. So he put a bunch of money, 1971, into the NIH to move forward with cancer research. And from that initial investment, we have had mountains of evidence and so much progression in the cancer world. That same action has never been done for cardiovascular, specifically vascular disease in PAD, which, by the way, kills more people than all cancers combined. So that's what I mean by politics. It's not that anyone's sitting around being, this nefarious person. It's just that if you don't have the right people in office or appointed giving the right advice, analyzing the data correctly, the resources may not go to the right space.
That is very fascinating because, that's one of the things that are more prevalent, right? You see people pushing more for that, more, trying to find a cure for cancer. I mean, you see a lot of commercials, right? And ads on social media and stuff about that specifically. But that is a very interesting fact that cardiovascular illnesses and disease kill people more than all of the cancer combined. Do you think that is caught up with the advancement of treatment in care when it comes to oncology and cancer medicine? Or do you think that was pre all of that?
I see what you mean. You're basically asking, have people always died at these numbers?
Yeah.
The answer honestly is no. But there's a reason for that. There's a reason for that. It's actually kind of counterintuitive because medicine has gotten so much better and people are living as a result longer. They are then living with their disease processes for longer as well. For example, if you are a man who has diabetes and you get diabetes in your 60s, and because of the advancements of medicine, you live to your 90s, you may have had diabetes for a longer period of time than somebody that was born in 1907. And so you therefore are going to see complications of diabetes that somebody else who would have died earlier never would have seen. And unfortunately, what is one of the major complications of diabetes? Heart attack, stroke, and amputation. Kidney disease, going on dialysis. Blindness from diabetes. Because the longer you have it, especially if your blood sugar is not controlled, the more likely this disease can affect you. And actually, diabetes specifically is a scourge on this planet. If you look at every single country, whether first or third world, you will see double digits of diabetes jumping in the next 30 to 40 years compared to what we are at right now, in spite of the fact that we have all these new medications and so much advancement. So with that is going to come a whole different genre of patients that have complications we potentially have never even seen before. And so we don't want to get to that 30 or 40 years from now and be cutting off people's legs left and right and be having people, fall around you with heart attacks. We want to be focusing today on the science that's going to lead us to maybe even a cure that can then stop that from happening. In the same way Nixon did with the money, he didn't think that. But then, even with Biden most recently, what was Biden's cancer moonshot project? It was cancer. Again, he said, cancer is the moonshot project. So we have to ask ourselves, what's the reason for that? Now, cancer is a top 3 killer, along with trauma, cardiovascular disease. Cancer is the top 3 killer of people in the US. So again, appropriate indeed to focus on it, but not appropriate to focus on one and not the others. So to answer your original question about politics, that's where politics can sway pretty aggressively, what the focus is, where the money goes. And that, of course, has very major outcomes that we need to think about, especially since this is our taxpayer money.
And it's so fascinating that stuff is not like at the forefront too, like just all of it, like looking at it holistically, like how can we advance our, medical science to where we can attack all of these things, and not having the right people in place. And from many politicians that I've spoke to, it seems like things do not become a problem until it's like personally affected or like, oh, I know somebody who's had XYZ, or, I have an advisor who has had someone who's had XYZ. So we're going to focus on that now. Side note, when I had to take Accutane for a little bit of time, my dermatologist recommended it, and they had to do like a whole bunch of like blood tests and, analysis to see like how you are, emotionally and mentally. Because if I remember correctly, she said there was a US senator whose son had died by suicide while on that medication. So,
That is exactly
yeah,
correct. Exactly. People are affected by, and that is normal human nature to be affected by something that you have seen close up. Um, and that is the reason, I mean, right there, that is the nail as to why you need healthcare workers in office. Because the Washington Post just put out a article that said the number one issue, it's always been in the top 10, but the number one issue that's going to be deciding these midterms is healthcare. When you talk about midterms are won on domestic policy. General big elections like the presidency are won on foreign and domestic policy, but midterms are domestic policy. Right now, the two giant domestic issues are immigration and healthcare. These two things. And so healthcare aspects are very convoluted and confusing. Some would argue even purposefully. And as a result, it is important to have people who are close to the problem, who understand solutions, being in a position where they can have conversations. You don't want people who are completely idealistic saying things like, well, we can give everyone this top-notch healthcare, while somebody else is saying, well, who's going to pay for it? And you also don't want somebody to kind of dumb it down to a level where whatever solution you get has all these unintended consequences that you never thought about. So you need the right people sitting down and saying, this is a big problem. It's going to take a while to solve, but we're not doing ourselves any favors by randomly, playing whack-a-mole with the healthcare issue and just solving things with little band-aids without thinking about the population's health over the next 30 years.
that's fascinating. I do want to dig into that a little bit more. But just like the last question in this segment, do you think a lot of Americans realize how much medical decision making, even in the grand scheme of things, as far as like, moonshot projects, do you think they realize how much that has already moved out of exam rooms and into like policies and legislatures and things? I mean, do you ever have patients who ever come to you asking for something, or any colleagues of yours, and they have to tell the patient that we're not able to provide this kind of, healthcare that you are looking for because of, policy changes that have happened?
Absolutely. I mean, every day. But it's not just like the government's not letting you do X, Y, or Z. It's also, the government and their decision makings in terms of law affect insurance. Insurance is one of the big things that affects the type of care a patient can get. I literally, just in the last few hours, I've had a situation where a patient needs something that I cannot provide because the insurance company is not on board with it. And it would take literally an act of Congress to change the way that the insurance companies can deny things that a doctor is multiple doctors, frankly, are saying is necessary. And people have like taken the social media and done all of these other things to try to shed a light on this particular issue. But this is just one of many, because, even the insurance companies, going back to politics, if you come to the hospital and you have amazing insurance, okay, and your brother comes to the hospital and he has Medicare, basically, and, a sister comes to the hospital and she has no insurance, all three people show up in the ER. The person who has no insurance, by the law, we must take care of, and we happily will take care of and spend the money to take care of them, but only in that immediate time period. But let's say that is a, $10,000 bill. That person doesn't have insurance, so the hospital has to eat that cost. The next person that comes in with Medicare, well, Medicare pays about 80 cents to the dollar. So the hospital, again, has a little bit of a cost that they're going to have to eat to accommodate this. So then when the person with good insurance comes, the Blue Cross Blue Shield, the United, whatever it may be, the hospital says, you know what, your bill is $20,000, because if you pay this, I can sort of compensate for these other two. And this whole system is jacked up, right? And you can't hospital, you can't fault the insurance people. So the insurance people are very defensive. No, what bill is this? I disagree with this bill because I'm going to fight it. I'm going to do. And who gets caught in this rigmarole? The patient. The patient gets tortured. The person who is sick, who right now needs all of our support, that person is on the phone with the insurance company explaining things that they barely can understand themselves and getting angrier and angrier and sicker and sicker. At the same time, the hospital can't just eat these massive costs. They would go under. we as a government and a society do not have a good safety net for a lot of people so they don't have insurance. And so again, you tie it all back to politics and policy. And the answer is not let's just pay for everybody or let's not pay for everybody. The answer is getting into the weeds, looking at the nuances, and having laws in place to ensure that we get the best out of things. Right now, AI is hitting the scene. The first thing that's happening, even from people who are AI gurus, is saying, all right, how do we put laws in place to police this so that we get the most out of it and we don't obstruct ourselves, but at the same time, we're safe? And people are thinking about it, thinking it through. Why can't we do the same thing with health? Right now, again, we're doing these sledgehammer moves. We're working on a system that was developed 50 years ago that doesn't work for our population anymore. And while we're doing all this, people are dying. People are getting thrown out of office who maybe would be good at their job if they were allowed to actually practice. And most important of all, the country as a whole is getting sicker. Today is the first time in American history where if you have a child today, they have a lower life expectancy than you do. That's craziness.
That's
crazy. Yeah, it's just crazy. But these are facts. So we have to do something about it.
Yeah, we do. Yeah. It's going to take all of us, wow. Diving a little bit into policies, I do want to just touch on vaccines because that's a hot topic right now. Speaking about it clinically, so when public figures push or roll back vaccine recommendations, what is the first medical consequence people are expected to see?
Well, when you push back vaccines, you are immediately opening up the country to a serious medical problem. Because the reason that we vaccinate against certain diseases is because they are very contagious and because they are deadly. And when you don't have a critical mass of people that are vaccinated in a community, then the illness, the disease can penetrate into that community. So even though, their argument is, oh, well, let it be the choice of the person. But the problem with that is that if it's the choice of the person to not vaccinate, but the child still comes to school, and there's not a critical mass of people vaccinated against measles, let's say, you can get a pretty major outbreak. And this is no longer maybe this hysteria. We know for sure that's what happens. We literally saw it happen just this last month. Look what's going on in the Carolinas right now, for example. Mm-hmm. So rolling back vaccines is a really big deal. The other thing is, in medicine, everything has risk and benefit. Absolutely everything. Even if you get shot right now and I take you to the operating room, giving you the anesthesia has some risk. But in the scheme of things, if you're bleeding out, you need that surgery for me to control the bleeding so that you can survive. So the risk versus benefit is that you're going to go for the surgery. When you get on an airplane, the plane can crash. That is true.
Yeah.
Plane crashes is so low that it is worth billions of people flying every day. Vaccines fall into that type of category. There has been extensive research globally where we have shown that vaccines, the ones that we use on a day-to-day basis, the ones that that have reduced mortality in children significantly since the 1900s, those vaccines are safe. We know that. And even though they're saying that there's a little bit of risk of that or this, again, the benefits are really the most important thing that need to be focused down on. I have no issue with people studying vaccines further, no issue with people asking the questions. Science is all about questions. But to make blanket statements without doing the evidence part of it, without doing the hard work, that is just hysteria. And that is something that can really hurt the public. And, the thing about it is all of these people currently, who are saying these sorts of things are used to talking like this, kind of speaking off the cuff. If you and I are having a conversation, I may say things that are hyperbole. But when you're a government official and, CNN picks up that statement you made and puts it on TV and a bunch of people listen to it, taking it as gospel, now you're hurting the public. You can say these quietly, and you can think that there may be something scientifically there that you can study, but you can't just come out swinging, making stuff up, and then just saying, oh, sorry, I backtrack on it. For example, the Tylenol fiasco.
Exactly.
That's just not acceptable. And it breeds complete distrust in the institutions.
No, sorry, go ahead. You can finish your thought.
I'm saying it breeds a complete distrust in the institutions. So tomorrow, when the institution really tells you something that you need to know, you're like, they just talk nonsense. I'm not going to listen. And that's the kind of stuff that leads to pandemics.
That was wild. I remember sitting right here watching that press conference happen about, Tylenol causes, autism or all these kinds of things. And even the measles things. We literally just had a case reported here in Lincoln, Nebraska. And they said, if I remember correctly, it was like the first case since like the 70s that the city reported. And that outbreak is currently happening. And people say, like leave it up to the parents. But like you mentioned, the problem with that too is that like if your kid goes to school and there might be a kid who's immunocompromised or something like that, or there's not enough herd immunity built up, then that does impact, the school population. And then from that, schools are literally a breeding ground for like illnesses to go home and then rapidly spread. But, I guess just to you touched on it a little bit, but like from a physician's perspective, what real life health failures is the message "Make America Healthy Again" reacting to? Because some of the things that they're coming out and saying, again, the whole outbreak with measles, rolling back vaccinations, the Tylenol stuff, I just feel like we are going to like lose all the progress we have made, in scientific advancements to insulate ourselves from these illnesses and disease that could come back from, decades ago.
Well, most definitely, we are opening ourselves up to things that have gone away. And we are bringing back diseases, to your point, resurrecting things that really we thought completely taken care of. And that's problematic on many levels. One is the obvious level that if you bring diseases back that we don't have immunity to, and we've not been exposed to, that populations and generations have not been exposed to, you can see it come back with vengeance, and that could be really problematic. But beyond that, you're also focusing on things that have been put to sleep. And as I just said, we have millions of other major problems that are killing Americans right now, healthcare issues. And by focusing on science that has been already dealt with and putting time, money, investment into the stuff that's already been proven, just because you want to say, oh, maybe it has not, or I want to pull this string, you're taking away from something else. It's interesting because it's the very argument that they made originally, saying that, well, money and resources are being put and invested into the wrong space, but then the same thing is happening now. Again, I want to be very, very clear. This is not a dig on going and exploring things that may prove to be bad. For example, if you go back to like the 50s and 40s and you went to a shoe store, there were x-ray machines in the store, and you'd be able as a child to stick your foot in the x-ray machine and hit the button 50 times for fun, because we didn't know that this sort of radiation can do. So, and as time has progressed, we learned that. So, and there's been many instances in history, in science, where dogma has been challenged appropriately and new science has come out. But it has to be done in a specific way. There is a scientific method. It is long and boring and slow and expensive. And if you want to sign up for that ride to really answer this question, to get to the truth, that's okay. But again, to mix your feelings and your emotions with basically what you're considering your truth, and then bring that out to the public as the way, that is really what is wrong. So to speak specifically about what's going on now, there have been some major failures. RFK now is got a whole new kick about 5G towers and cancer, and a focus on that. And the argument is, we're not saying it causes cancer, but we're also not saying that it doesn't cause cancer. Let's study it. Okay, but how much money is going into that while all these other patients are getting amputated? And again, it's not to say one is better than the other, or one should be focused on other than compared to the other. But the population of people in the US need to be taken care of as a whole. And it's the government's job to say, okay, we're looking at all the things that are killing Americans, hurting Americans, and we want to work backwards to figure out how we can change certain things so that the most number of Americans can be protected. And I don't see that type of intelligent thought being put into the certain things that they are picking up to study. There's nothing wrong with making America healthy. I wouldn't say make America healthy again. I don't remember the last time that we were, fully. But absolutely, I sign up right now to make America healthy. I would completely join forces with, ensuring that the right foods are being eaten, ensuring that the right foods are being given to our kids so that they're not getting sick. Something is happening where we have an obesity problem, we have a cancer problem, we have a PAD problem. But I think the focus is on the wrong spot. And we have enough science to say that maybe we should be looking at plaque formation, genetics, all of these other things that have come out to say that these are the root causes of why diabetes does explode. But instead of doing that, we're putting money into kind of these wacky side projects and diverting attention away from the real issues. And I can say with certainty that in another 50 years, when we look at our population, we're not going to see some big dent in Americans' health if we don't do something decent about the real issues that Americans are facing today, health wise.
And that's why I think it's really important to like have these conversations with, other medical professionals, because, RFK might say something and then you have your wellness influencers who, go and amplify it to their many followers and things and sway people one way or the other. And that can be very, very dangerous. I don't know. I don't know if you have any thoughts on that. Everybody can be like, come an expert, right? Like when it comes to, wellness and health and, post videos and gain a following and, further their own celebrity. But some of that stuff like could be very helpful, but some of them could be really damaging in the grand scheme of thing. And I think with the spread of social media, right? Like if you are a wellness influencer and you tell, your millions of followers not to get vaccinated for one specific thing and, 100,000 people take your advice, that can cause like a real dent in just the progress we have made as a society.
I completely agree. It's very unfortunate. And the thing about it is though, like these wellness influencers are not like bad people, which is like they're not out there trying. It's not that they know the truth and they're trying to like obfuscate it. They really believe the nonsense that they're peddling as well. They're engaged in it themselves. And usually that comes from a place of ignorance. And people could say, oh, it's elitist to say that, or no, it's not elitist. I went to medical school for 10 billion years, and then I did a residency, and then I did a fellowship. And so I know this. I mean, I probably can't balance a checkbook that well. I certainly can't change my oil. I'm not a lawyer. I can't do law things, but I know this. And so I can say this with certainty. When you are in a medical field talking about medical things, there are multiple things that are involved in the outcome of a patient. And one of the biggest mistakes that wellness influencers make and people who are kind of like dabbling in medicine make is the confusion between causation and like the idea basically of saying like this happened, so this happened as a result, without realizing that there's a correlation versus causation conversation, which is a lot of C's. But basically what I mean is just because something happened after something else, it does not mean that those things are connected, right?
Right.
Today, I had a hamburger for lunch, and then I almost got hit by a car when I was walking home. Should I stop eating hamburgers? No. It seems like such a silly thing to say, but there was a million other things that happened. And probably the reason I almost got hit by a car is because I was on my phone. So, once you would look at all of the effects on a person, you would look at all of the different variables, and you would take a sample size of 500,000 people who all almost got hit by cars on one day, and you would look back at all of their things, and then you would identify what are the predictive things that cause this outcome. And we are, again, not ready to do that. And these influencers are not equipped to do that. It's very easy for somebody to have something happen to them, and then if it's a negative outcome, blame it on something that they perceive is the reason why this thing happened. And that is emotional, that is not scientific, and that is extremely dangerous because emotions can really push forward. When somebody is talking with a lot of passion about something, you tend to believe them. That's human nature. Somebody's looking you in the eye, believing what they're saying, and telling you this is the way, versus your doctor who may be saying, well, it could be or it couldn't be. You are going to gravitate towards the person who's certain because we like the strong man syndrome. But
Right.
The problem with that is in science, you can't do that. You can't do that or you will get burned. And the influencers have no accountability at the end of the day. But when your child sadly gets measles and God forbid has something terrible happen to them, you can't go sue the influencer. You can't do anything. And so it's really important to recognize that whether they're doing it out of ignorance or they're doing it out of being malicious, influencers are not the place to get your medical information. And if you go to a doctor and the doctor is not communicating with you clearly and not telling you in a way that you understand that this is the right thing to do, go to another doctor. Doctors are also not all the same. In the same way one mechanic is great and another one isn't, doctors are like that too. It's not just about our surgical skills. It's also about our patient contact. And if I don't sit and explain to you why I think the way that I think, then I'm a crappy doctor and you should get someone else.
Well said. Well said. I just have one question in this segment really quick. With that, right? So being certain, and we like the strong man, that is very, very certain and very passionate and stuff, versus a doctor who might, look at things. It could be this, it could be that. So I have just overall just seen online and just everywhere, even in my personal life, people having trust in medicine erode. What do you think fails first? Doctor-patient relationships, like hospital capacities, or public health infrastructure overall?
I think the public health infrastructure is what first fails, because when you have the public infrastructure fail, right? For a small example, a patient cannot get in to see a doctor in a timely fashion when they're sick. Illness does not come with an appointment. Illness just happens, which means that you need to see your doctor in a timely fashion, especially if it's a very serious thing. Like one day you find a lump in your breast and you want to get in to see your primary care doctor and they tell you that the next appointment is in 6 months, right? Or they tell you you need to call this number and you call the number and it's an automated machine and you can't get through and you just get frustrated with the whole system. And you associate that with the one person you see, which is the doctor. So if you go to a restaurant and you get a hair in your food, there's a million people that could have had an impact to ultimately have that hair in your food. But who are you going to complain to? Who are you going to hold? The waitress who's looking at you in the face, or the waiter, because that's the representative of the system, which is the restaurant that you're at. And that's exactly what happens with doctors. We are the primary representative, and nurses and other healthcare professionals, the living, breathing representatives. And so when something is not going right with the system, there's no insurance person you can yell at. There's no face to that. There's no name to that. There's only me. And so you as the patient see me as a part of this system, this crap system, and then say, well, if this whole thing is terrible and you can't even help me because doctors can't, there's very little we can even do where we can make things easier for you in terms of like getting an appointment sooner, or like we don't have any control over those things. So when we can't do that for you, and that was your main pain point, that's what breaks the trust. You're supposed to take care of me. When I see you, I'm supposed to feel good. But here I am with a hair in my soup, and you're telling me there's nothing you can do about it?
Right.
And so that begins the erosion of trust. Then you have the ideological next layer, which is indeed, and I completely think this is true, that on both sides, from the Republican side and from the Democrat side, we have had ideology spill into medicine. It has always been there to some extent, but science has been able to back it, and science has been able to say this is the right answer. And most of the time, both sides would align on that. And recently, really around COVID time and beyond, we have seen a big erosion of that and the management of things. And as I said earlier, you don't get to go back and have a redo. So there are a lot of people that are saying, no, you mismanaged me. If I have that hair in my soup that one time, am I coming back to this restaurant? No matter how many times you say sorry to me, right? Because something broke down in the system. So now I have a general distrust of what you say. And the problem is now when I have a general distrust of one thing, I don't trust anything. And so that's the same problem with government institutions. When you have an institution that says something and then backtracks on it or is wrong, then the trust in the entire institution, the CDC, the NIH, the FDA, the whole thing crumbles. And when you have the public not trusting their institutions, that's the first step towards a banana republic.
Yeah.
So it's important to ensure that the scientific process, which doesn't care if you're red or blue, doesn't care about anything other than the truth. What is the science? And if you follow that, it will lead you to the right answer.
Well
Well
said.
said.
I want to talk about your political action committee because I was on your website earlier when I was prepping for everything, and I saw that you guys had actually endorsed one of the candidates next door in Omaha's second congressional district, Denise Powell.
Mhm.
I wasn't aware that she was a medical professional, but from what I gathered, do you guys also endorse candidates who are strong medical advocates that have been advocating for different things within the medical field in legislatures and things?
Yes. So Healthcare for Action PAC specifically focuses on supporting, indeed, healthcare workers running for office, but really anybody that understands healthcare policy and that would make a good citizen, so to speak, in Congress. What is a good citizen? It's somebody who can reach across the aisle, who can understand somebody else's points, who does not feel that their ego is hurt by changing their mind. We don't have to come down and have this gang violence that we're having currently in Congress, where everything
Right.
ultimately does what? Come to a screeching halt, which serves nobody. What you need to have is a situation where you can understand that, oh, I see your point about this and I see your point about that. This is my point. Maybe I get 60% of what I 20% of what you want, and then we can move forward and we can do the right thing for the American public. So the lady that you described, Denise Powell, she's not a healthcare professional, but she has strong healthcare advocacy points. She's actually in the business world. And so we've supported people from business, from biotech. We've supported teachers. We've supported people who have been mayors historically, because it's not about just healthcare workers. It's about the humans that we're sending doing things for healthcare, and everything is healthcare. You being able to get into your car safely and make it to work on time is healthcare. Your kids going to a safe school where they can learn is healthcare. You being able to get a job that is not taxed so badly that you can't feed your family, that is healthcare. And so healthcare professionals understand that, because I see that on a day-to-day basis. If I have a patient that needs something done, but they cannot get into their car and come to see me because they don't have transport, they won't get their care. So I understand that the T not working in Boston or the subway not working in New York, that is healthcare. And so what we are trying to say is healthcare professionals have notoriously stayed out of politics historically, because we have been told that politics are dirty, people pick sides, and you are a doctor, so you don't want to see any of that. You just want to treat the patient. And that is true. Except now politics has spilled into our ERs, spilled into every conversation I'm having with a patient. The politician is standing next to me, dictating what I can and cannot do. So unless I have control over what that politician passes into law, I cannot help my patient anymore. So Healthcare for Action was born specifically for healthcare workers as a rally cry to join together to support the right people to run for office. We have supported a number of people since 2022 when we first started. And we do all kinds of things. We're about to have a big town hall that's going to have a doctor and a nurse who are both sitting Congress members who are going to be having a conversation with the public about where healthcare is in America currently and where we're going. We're doing another big town hall where we're having some very high level officials come through to talk about where healthcare is going and what the need is from the population in order to ensure that we're focusing our resources on the right things. We have no problem saying that this is a good thing, whether it comes from the Republican side or the Democrat side. But we also have no problem saying this is a bad thing, whether it comes from the Democrat or the Republican side. We are just here to protect our patients. And that is the reason why Healthcare for Action really exists. Because right now, if you got sick and you came to the ICU and you were on a ventilator, and I was standing next to you and I wanted to give you a couple units of blood, but the ICU doctor doesn't want to, and the infectious disease doctor wants to do something else, we don't stand on top of you and start screaming at each other. We go out of the room, we have a conversation with each other, and we make a good plan that allows you to get the best success possible. And in this analogy, you are America and we are Congress. So it's our job to do the right thing for you. You brought your trust in us by coming to the hospital, the same way we put our trust in elected officials by electing them. And it is their job to ensure that they're doing what the people want and giving us the best outcomes from a healthcare perspective and from everything else I mentioned: economy, transport, safety, etc.
Yeah, I think I saw that much more prevalent in 2022 after the reversal of Roe v. Wade. And before we started recording, I mentioned to you, I was speaking with different OBGYNs. And when I would go to our legislature here in Nebraska, I would, see a lot of medical professionals and doctors and physicians come in their white coats and try to talk to members of the legislature, be in the gallery watching everything, try to set up meetings with these senators to try to educate them on it. But sometimes it's just like the ideology just overrides all of that. So no matter how many doctors come and talk to you, things don't move forward. And I think that bleeds into my other question about which you answered, why electing medical professionals does electing medical professionals solve something that advocacy alone can't? Because no matter how hard you advocate it for, if ultimately there's just that gridlock and no forward motion, then America suffers at the end of the day. Right. So I think that's really cool. When is the town hall happening? Just to give a shout out so people can.
Sure. So March 26th is one of our in-person town halls. And then we are going to most likely do it at the end of April, the second town hall, which is the large one I'm talking about. And I would be thrilled to send out the invite to you so that you could send it to your group, because we would welcome anybody who'd be interested in hearing what these sitting congresswomen have to say.
Good stuff.
I will say, it's important to focus on something in America that we have sort of brushed a little bit past recently, which is the knowledge aspect of things. Confidence cannot substitute for intellect and cannot substitute for knowledge. Just because you say something with confidence does not mean that you're right. And America in general, we all, are, because it's such an incredible country and we have, I think the best people in the world, we have always been the ones that all the intellect. We've been the ones with the great education system, advancing critical thinking, and then bringing it all together to do incredible things like start companies, change the world, think about things very differently. But slowly, again, with that erosion, we've started to see a replacement of knowledge with confidence. In other words, we're saying you don't need to know what 2 times 2 is. You can just say 12 with confidence, and that's okay. Right. And people do get a little further with that. But the danger with that is that when you send someone like that to Congress, they're going to speak loudly. They're going to slam their hands on the table. They're going to say the right things. They're going to have the little billboards, but what they're talking is crap. And so it is very important to find the people that we have in this millions and millions of people country, and we have them, that have the knowledge and have the confidence and have the moral compass. That is the trifecta that sends a person to Congress to really help the United States as a whole. And we've not been doing a good job of that as public citizens, picking those people. In order for someone to think critically about something, they have to have basic knowledge to begin with. So we need to go back to those basics. Funny enough, making America great again, going back to that meritocracy, going back to the science, going back to the math, and going back to the humanities and saying, let's understand what's going on. Let's understand history. Let's understand how decisions are made, and let's understand the topic, and then make an intelligent decision to move us forward. And I think that is the greatest message that certainly I'm telling my kids, and what I hope that the public also probably agrees with.
Yeah. That was amazing. Just some closing questions, because I mentioned I really like to speak on issues affecting marginalized communities. And, the data tells us that lots of people of color do not trust going to the doctor. I mean, personally, I'm South Sudanese, and our community does not like to go to the doctor, does not like to seek out medical care. There's just been a lot of trust there. And I think that also just comes from like back home, bad experiences, with outside groups coming in and having an effect on the population there that has just led to a lot of distrust in the medical field when it comes to my group of folks specifically. But there was a research poll that had found conducted by Harvard with NPR, that 32% of Black Americans reported discrimination in medical settings and 22% avoided care due to fear of poor treatment. When a patient walks into your clinic to see Dr. Dua, right, carrying all of that history, and has possibly delayed cares for years, what do you change in your approach when you first see that patient?
Well, the first thing that has to happen with a patient is building that trust. And it's really important that when you sit in front of a patient, you understand where they're coming from. Some patients come happy, some patients come angry, some patients come scared, and they all come because of some historical event that has led them into the position that they're currently in. I've absolutely had patients come in, guns blazing because indeed they've seen two or three other doctors and they've not had a good outcome because they felt like the doctor wasn't listening to them. They're not wrong. I'll give you an example. So in peripheral artery disease, okay, which is again that disease process I was talking about that leads to amputation. We know that amputation in the Black community is significantly higher than in the white community. We know that. Now, it's been associated with things like socioeconomics. It's been associated with things with insurance. It's been associated with things with the doctor-patient relationship. But it's not that simple. It's more than that. There was a study that was done, and actually the data is published, that if a patient comes to a doctor who has a block, and the patient has a blockage in their leg, they are offered a revascularization, which is basically the name for the procedure where you try to restore blood flow. They are offered a revascularization up to 5 times before they're offered an amputation if they're white. If they're Black, they're offered a revascularization, which is again trying to save the leg, only 1.5 times before they're offered an amputation. So amputation rates may be higher in the Black community because they're getting there faster because they're told that that's the right thing to do. Now, you might sit back and think, oh my God, are all doctors racist? No, it's a systems issue. Again, going back to government, the reason that in cancer, and again, there's disparities in cancer too, but they're not as stark as they are in PAD, which is peripheral artery disease. The reason that cancer has been able to alleviate some of the disparities is because they've protocolized things. If a person walks into your office and they're this height and this weight and have this problem, they get this MRI and then they get this. And then they get the right treatment pathway. But if you just let it be the Wild West, that a doctor walks in to a patient's room and just decides, based on kind of what they're seeing, what they think, insurance status, whether or not they think the patient will take their meds, am I going to do a 7-hour procedure, Hail Mary on you, if I know that you have no home support and you're not going to be able to pick up your medications? Is it worth it putting you through that? Or should I just do the amputation for you and help you get out of Dodge? What's the right answer? See what I mean? So it's a bit more complex. So the first thing I do with my patients is I sit down and I give them all the options, every option. And I tell them all the good and the bad of each one. That builds a lot of trust. I also speak to them like I'm speaking to you now. We could be talking at a construction site. It's very straightforward. No messing around, no wishy-washy, but the truth, always the truth, even if it stings. That builds that trust with patients and then allows them to really partake in their care. But patients partaking in their care does not mean let the patient dictate care, because that's not what they're there for. If you have a cancer and you come to me and say, doctor, what should I do? I shouldn't be like, well, what do you want to do? Because you're going to be like, I don't know. I'm not a doctor. And that's actually more distasteful, I think, for the patient than to say, hey, this is what the data says. This is what you should do. But this is what you could do if you chose to do this otherwise. So I really build that trust with the patients. I will say, though, there are some entrenched behaviors that we need to break out of the medical system. I'll give you another example. This was a study that was done really quite a while ago about trauma patients. So if you're a trauma patient, let's say you get shot, you're in a car accident, and you turn up overnight to the hospital. We do whatever to you, you're saved, you end up on the ward floor. The next morning, the trauma doctor is going to come and round on you and see how you're doing. And that might be the first time that doctor meets you, okay? Because overnight somebody else was taking call. They found in a study where they followed around trauma doctors, they found that a trauma doctor in this study who would talk to a patient would spend significantly more time explaining and talking to that patient if they were white compared to if they were Black. But what was really interesting about the study is it didn't matter if the doctor was Black or white. So whether the doctor was Black or white did not change how much time they spent with the patient. So there's something inherent within the system that needs to be broken that can only, again, be done on a protocol level. We have to move away from saying, the healthcare system is racist and like each doctor needs to go through this specific training, because that will not, that's fine and it checks a box and it seems like it's doing something, but it doesn't actually move the needle. What moves the needle is taking it out of the hands of the healthcare system and saying, these are the policies. This is the protocol. When you're in with a patient, this is what you need to be doing. If you haven't achieved these goals, then you can't move on. That is what gets everyone equal care. And that's the kind of thing that will change the way that the minorities are treated and the outcomes that minorities unfortunately face because of some of the racism within the healthcare system.
Why do you think that is? That regardless of, the race or ethnicity of the doctor, they still spent significantly more time with white patients?
It's impossible to say. Impossible to say. Honestly, I don't know. It can be anything from, you mentioned yourself. I'll give you an example. You said yourself that in the Sudanese community, um, they're wary of the doctor, right? So let's say somebody from your community did get shot and was in the hospital post-operatively. Okay. They don't want to be there. They're very uncomfortable. They're not used to the system, right? And they just want to go home. And the doctor now walks in and starts a conversation with them. And the patient is not doing right, feeling scared, feeling uncomfortable. The doctor may pick up on that and say, okay, you know what? You're all right. Everything's fine. I'm just going to give you some medicine and I'm going to leave. I don't want to stress you out anymore. I don't want to explain anymore. I just want to leave you alone. That's versus if they walk into a different room where the person is perfectly fine. They've been to hospital millions of times. They know the nurses by first name. They may sit and keep you in the room for half an hour. That's also bad, by the way. So we don't know the conglomerate of issues that are ultimately resulting in this. I will say this though, neither side is the victim. Like, it's not like the patients don't have any accountability or responsibility, and it's not like the doctors don't have any accountability and responsibility. This is a system in which both sides have to engage in order to get the best outcome. If you have a patient that will not engage, it is our job to try to draw them out, try to speak to them, try to help them. But there's a limited amount of time. And if we don't have the right family structure or the patient not being able to engage in the right form, then the doctor is not going to be able to optimally do their job. And these are facts. These are facts that we are scared to say because we don't want to be painted as one thing or another. But, I'm from the Indian community and I can tell you exactly what you just said. That's the same thing in our community. Nobody wants to be there. And so if they are belligerent or, even if it's from a place of fear, the doctor will pick up on that and then say, okay, I'm going to back away from this room. Not that you're not going to get treatment, but you might not get the same beautiful explanation and all these other descriptions. So to answer your question, there's been a lot of studying on this, why certain things happen the way that they happen. But as I mentioned to you, it is interesting that a black doctor seeing a black patient was still doing the same thing, as a white doctor. So it can't just be, oh, this person is racist. There has to be something else going on that is resulting in this negative outcome.
I have heard the remedy for that would be, get more black doctors, more black health professionals in there to really, change that. But if that alone isn't fixing the issue, so there's a more systemic thing that needs to be studied and figured out and remedied with that.
Oh, no doubt. I think part of the problem is making these very complex problems, unfortunately, dumbed down. We wish there was a silver bullet to just take away racism from medicine and everybody would have the same equivalent outcomes. And we say this okay, minority populations do work, but even in white populations, if you look at rich people versus poor people, you're going to see a difference. If you look at zip codes, if somebody lives in a zip code that's close to the main hospital versus a zip code that's further out, you see a huge change in life years. If the person lives 30 miles away from the hospital, they actually have a different life expectancy, white or black. So it's not just about race. And I think that's been one of the things, talking about distrust and kind of building, incorrect narratives. We have to accept that there are very complex things at play here, and simple answers to complex questions just make things worse. If we really want to study this and we really want to take time and figure it out, then we can't just say, okay, our hypothesis is that everyone is racist and therefore this is what's happening. So if we take that away, then this will go away because we'll go down the wrong rabbit hole. I'll give you an example, not of race, but there was a situation. This is with the WHO now. And the UN many years ago during around 2000, they had the millennial goals where they wanted to reduce maternal mortality rates. Okay. And maternal mortality, when you think of a woman who's just delivered a baby and the first year of life of that baby, and if a woman dies in that time, that is maternal mother mortality. Horrible, obviously. So they decided globally they want to reduce these rates. So what they did was they said, okay, we're going to put a lot of money into controlling hemorrhage, which is bleeding, and controlling infection after you deliver a baby, because this kills a lot of women. And it does. Infection and bleeding kills a lot of women when they're pregnant. So they put all this money into it. And at the end of the cycle, when they looked at their numbers, they were like, okay, we did a little bit. We reduced paternal mortality a little bit, but it was nowhere near the amount that they thought they would reduce maternal mortality. And the reason was because they missed the biggest killer of women who are in that situation, which is heart disease. They get rheumatic fever and they heart fail. So they've completely neglected this huge problem, which is the real driver of absolute numbers of maternal mortality globally, and focused on just OB-GYN things that indeed kill women, but was not like the primary driver. And that is what I mean by the greatest intentions. But if you don't, you got to focus on the science and not the ideology. You can't focus on feelings. You have to focus on what's reality. And in reality, if you looked at the numbers, women who just delivered a baby in that 1 year were dying of rheumatic disease. So if you wanted to save that population, you have to put your investment there, even though it may be more fun or make more sense or sound better on stage to focus on bleeding and infection. Do both. But I think, that's my point about kind of being in the wrong space and then ultimately not getting the outcome you want millions of dollars later.
Great. Wow, Dr. Dua, this has been so fun. I could ask you a million more questions, but I want to be respectful of your time. You got to save the world out there. And we really appreciate the work that you are doing. For people to learn more about the Political Action Committee, and any resources that might help people become much more educated, especially with this midterm elections. Like you mentioned, midterms are one on domestic policy, and healthcare is going to be like the number one thing. What would you recommend people to read or research about to become more educated on all of this?
I think the most important thing is to look to see whether or not the people that you are electing to Congress or picking for Congress actually have an agenda for healthcare that involves talking to experts and making a good plan. There is no answer to this currently. We've never sat down and really tried to sort this out. It's going to happen as time passes. So the most important thing you can do as a citizen is to ensure that the people that you are electing to represent you are people that are going to be ready to listen and that are going to be ready to listen to experts specifically, that are not going to be tainted by ideology, and that are going to be in a position where they can really, put a vote in that allows them to move to the next level in terms of over the next 10 years, getting a healthcare system that works for our country. Because this is not going to happen by the midterm elections, of course. And be very weary of people that tell you that it will. Solving autism by November or whatever was said, this is just not going to happen. That ridiculous. We need to recognize that this autism is an issue, and if we want to solve it 100%, we should focus on it, but we got to do it the right way. Otherwise, we're going to end up right where we are, just millions of dollars later, and it'll be a big failure. So in order to learn a little bit about our PAC and the candidates we're supporting, if you go to www.healthcareforaction.com, all one word, healthcareforaction.com, you can see some of the candidates, you can see some of the work that we do, you can see our board and the number of physicians and nurses who are on it. And then if you want to educate yourself a little bit more about the healthcare bills, the biggest thing would really be talking to your doctor about where things stand. And the doctor will be happy to speak about it, I promise you. And what we really need as the next step in the society. And then see whether or not the congressperson that you're electing aligns with those sorts of thoughts.
Thank you so much. This has been amazing. We hope to have you back, especially, as things progress on, because we got, a few more years of this administration, and I'm sure there's going to be a lot more changes that happen that will create a lot of conversations, and not just with the midterms, but also leading up into the next presidential election. So thank you so much for the work you do. We really do appreciate your time.
Thank you. It's my pleasure. It's lovely to see you.
You as well.